Random bloating, skin rashes, headaches, constipation, water retention, drowsiness, nausea, anxiety, all seemingly unrelated concerns. They don't bother you every day. Maybe they don't even bother you every week. You can't figure out what's triggering these symptoms, but they're nagging and they're getting more frequent or more intense. Everyone and their uncle has an opinion on what you should try, often whatever worked for them. You've taken some supplements, you've tried the creams, you've tried changing your diet, you've tried sleeping upside down with your socks on backwards, but nothing seems to be making a difference. And if anything, maybe things are getting worse. Well, in cases like this, dealing with some of these very common concerns, food sensitivities can sometimes be the culprit. And it might surprise you to hear that it's not just these big common concerns that could be caused by food sensitivities, but other things as well. Things you might not even take notice of because you've been dealing with them for so long. There's so much confusion, misinformation, and discussion around food sensitivities. I'm here today to give you the facts and clear up the fog surrounding food sensitivities. I'm Dr. Tiffany Dzugan, and I am a naturopathic doctor in the GTA and a member of the Vitamart educational team. Unfortunately, this is a story I hear all day, every day in my office. Patients tell me they've been dealing with XYZ, you fill in the blank, for 3+ years, and it's gradually getting worse, and they've tried a bunch of things with no success. This is where the experience and expertise of a healthcare provider is important. We have the objective view of the symptoms you describe and run it through the database in our head, sorting out what could be causing each symptom you describe and the combination of things you describe. When I go through this process with my patients, sometimes we end up on the food sensitivity discussion. And there is certainly buzz around the whole food sensitivity thing now. Often my patients will bring it up before I do. We all know sensitivities exist, but there's so much confusion, misinformation, and disagreement about food sensitivities that it can be tricky to weave through it all and make a decision. My goal for today is to walk you through all things food sensitivity. What is it? What issues can it cause? How do you know you have one? How do you resolve one? Can it be resolved, or am I stuck with it forever? Stick with me and let's clear up the confusion. First things first, what is a food sensitivity? Is it the same thing as a food allergy? Is it the same thing as a food intolerance? Let's tackle the allergy question first. In short, no. A sensitivity is different from an allergy. And this doesn't just go for foods, this goes for any type of exposure. An allergy activates a specific type of reaction in your body, and a sensitivity activates a whole set of different responses. For those of you science nerds like me, an allergy activates IgG antibodies, and a sensitivity activates IgG antibodies in response to an exposure. So this is a key difference here, because often your medical doctor or another practitioner will offer you allergy testing, and this testing is absolutely important. However, it's measuring something totally separate than a food sensitivity reaction. We're going to get into the testing options in a little bit. So back to the key question, what is a food sensitivity? Essentially, it happens when your body takes in an exposure, in this case we're talking about food, and it sees this food particle, or antigen, as a threat. In response to this threat, your body mounts an immune response, led by these little IgG soldiers to fight off the threat. And the release of these antibody soldiers causes symptoms. Now, how about food intolerances? Do these differ from food sensitivities also? In short, yes. These are also two totally different ideas. A food intolerance, for example, someone who is lactose intolerant, means that you lack the enzyme needed to break down that food. This also causes symptoms, and sure, they can sometimes look similar to a food sensitivity, but we need to tackle these issues very differently. Some of you might be starting to question, so why am I developing sensitivities now that I never knew I had before? Great question. And my best guess is that the exposure reached a threshold that is now activating a response big enough for you to notice. Sometimes it's more exposure to the specific food, as in you're eating more of it than you used to. In some cases, it could be that your digestive system is more susceptible at times, and this creates an opportunity for things to interact that otherwise wouldn't or couldn't, and causes an overreaction from the body. I know it sounds like mumbo jumbo, so I'll explain it like I do to my patients. Our gut, our digestive system, the colon, is lined with cells. They sit close together and act as a wall, and they absorb things and make energy and sometimes send things out to be eliminated. When our digestive system has any sort of inflammation, these cells tend to separate. And this separation allows certain particles to enter between them when they pass by. When the particles enter, they get into the bloodstream, which is why an immune response occurs. These particles, or antigens, are now entering a place they aren't anticipated to be. So your body reacts. And the reaction is what causes the symptom, not the actual food. Interesting, right? Okay. Next, I want to talk about signals you might have a food sensitivity or certain symptoms that you might experience, because the symptoms that can arise are actually a very, very long list, and not everyone knows that. I already mentioned the bloating, constipation, diarrhea, skin rashes, headaches, water retention, drowsiness, nausea, anxiety. And although this already sounds like a long list, it gets longer. Food sensitivities can also cause symptoms like congestion, hot flashes, a runny nose, insomnia, the inability to lose weight, chronic pain, fatigue, brain fog, cracking heels, acne, abdominal pain, irritability, joint pain, acid reflux, and even depression. Now, I know this video is all about food sensitivities, but I do want to stress that any and all of these symptoms can also be caused by many other things. This comes back to the idea of visiting a practitioner to help you sort out whether for you it could be food sensitivities. One key thing I want you to note is that the reaction, whatever that is for you, whether it's bloating or eczema, isn't necessarily going to happen right away. So yes, for some people, they eat something and then they need to rush to the washroom right away. They're lucky because they know what they ate and can narrow down what it caused it. Okay, maybe lucky is a strong word here, but you know what I mean. A food sensitivity can actually cause a reaction for up to 72 hours after consuming the food. So what does that mean? You get a headache one evening, and it could be because of something you ate for lunch 2 days ago. And this is why when it comes to food sensitivities, food tracking can be so critical, because who can really remember everything they ate in the last 72 hours right off the bat? The next thing we can discuss is sorting out whether you truly have a food sensitivity. There are a couple ways to do this. The first way is the obvious thought, a food sensitivity test. So keep in mind what we said before. This is different than an allergy test. Another way we can identify a sensitivity is through something called an elimination diet. There are pros and cons to both of these, and I recommend both of these options in clinic with my patients depending on what would work best for that person. So let's talk about these differences. Key differences here are cost, speed, accuracy. My Coles notes for you here are basically that food sensitivity testing is way easier, way faster, way more expensive, and not completely 100% accurate, but we do get a good head start. So this food sensitivity I'm talking about here is a blood test. In my opinion, this is the only type of test that is backed by science. There are practitioners who will test food sensitivities in other ways, but again, maybe not backed by science. So this blood test, which I recommend from time to my patients, measures your body's response to a bunch of different foods. There are different profiles you can pick, either 120 or 200 plus foods, and your practitioner can help you pick the right one depending on how you normally eat. This test will spit out a beautiful colored report telling you whether each food is okay for you or causes a reaction. And we use this info to dictate next steps. Again, this test is quite pricey, but it has its benefits. Is it 100% accurate? No. But it does give us a base to work with, and it requires no work on your part, just a quick trip to the lab. One important limitation to note about these tests is that they will only measure things you are actively consuming. For example, if you've been avoiding gluten because you think it causes some issues for you, then this test will not show you as sensitive to gluten solely because you're not consuming it. So if you're going to do the test and you want the most possible information, you have to be actively consuming all the foods it tests within the previous few weeks. Okay, so what's the alternative? It's something I call the elimination diet, and it's certainly more work for you than the blood test, but it is 100% accurate and free. And typically it's this, or often a variation on this, that I recommend to my patients. It's basically removing big food groups from the diet for a certain amount of time until your symptoms go away. For some people that's 3 weeks, for others it's 6 weeks. And then we slowly reintroduce foods one at a time to see if that symptom returns. So as I mentioned, it's a lengthy process and can be quite difficult. But if you're really motivated, this can be an amazing way to determine how different foods make you feel. And there is a correct way to reintroduce the foods. If you want more info on that, let us know in the comments. Okay, let's say you've done one of these 2 styles of determining sensitivity. Now what? This is the important part, right? Do you need to deal with this forever? Can you never eat these foods again? No and no. For one, you are your own boss. You get to decide what you eat, and now you're just more informed about how your body feels when you eat different things. For some people, this means we know we have an issue with milk, for example, but on a special occasion, we decide to consume it anyways, and we know what to expect when we do. Often what I recommend is doing your best to stay away from these foods that make you feel yucky while you do the work to heal your gut. This all goes back to that mumbo jumbo I was rambling on about earlier. When you have inflammation, your cells separate. We can work on your digestive system to heal those gaps and reduce your response to foods. So take out the offending food while you work with your naturopath to heal your gut, then reintroduce the food. And often the response is either gone or not as severe. So yay, food sensitivities are not a life sentence. I hope after all this discussion, there's a little less confusion around the whole food sensitivity thing for you. We talked about the differences between food sensitivities, allergies, and intolerances, what symptoms can be from food sensitivities, hint, all of them. How do you figure out if you have a food sensitivity, and what you need to do if you have one. Again, I'm Dr. Tiffany Dzugan. I'm a naturopathic doctor in the GTA and a member of the Vitamart educational team. Thanks for sticking with me, and remember to let us know in the comments if you want more info on how to properly reintroduce foods after an elimination diet.